Hi, my name is Marino Asa, and today I'll be demonstrating the tracheostomy care. So before I get to my patient, I'll verify the physician's order, then I'll go to my patient's room. So when I get to my patient's room, I'll wash my hands, provide privacy, sorry. Hey, good morning, I'm here to perform your tracheostomy care. That is okay with you? All right, thank you so much. So I'll raise the bed to a working height. I'll determine if my patient requires suctioning, but right now my patient doesn't require suctioning. I would also be doing my own physical assessments while doing all this. Then I'll go ahead now. I would disconnect my patient on the oxygen supply. After disconnecting my patient on the oxygen supply, raise my bed in a working height, place my patient in a Fowler's or semi-Fowler's position. I'll go ahead now and I will set up my work supply that I brought in already. So I'll wash my hands, perform hand hygiene, then I'll go ahead, don my clean gloves. Don my clean gloves. After donning my clean gloves, I will open my tracheostomy care trach. So when I open this, I'll send my hand and I can take out the gloves, place them. Then I'll send my hand and grab my dressing. So I'm touching just the outside or the shiny part. That's the part I can touch to maintain sterility. Then if I want to touch inside, I'm touching just about an inch. Then I'll open my dressing on here. Then I'll go ahead and I'll pour all my supply on here. So I'll go ahead now. I'll fill this with some soaking solutions, one part with soaking solution. Then I'll fill the other part with normal saline. Then I'll keep it right here. So while I've done this, I'll use my gloves, my clean gloves. I'll go ahead, I'll unlock the inner cannula. Then I'll follow the same curvature. I'll pull it out and I'll dip it in my soaking solution. Then I'll still use my glove hand. Then I'll pull out the tracheostomy dressing, the dirty one. I'll put it in the trash. Take out my now used gloves, trash it. Then I'll go ahead, wash my hands. After washing my hands or perform hand hygiene, I'll go for my sterile gloves. So I'm touching just the outward part. So this is sterile, so I'm treating it like a sterile, like my original sterile field. So I'll open this here. So I'm also touching just about an inch outwardly. Then I would use my dominant hand and I'll pick this. So I'm touching the inside part. So this is sterile and should be treated as a sterile. So take our time so we don't get the gloves torn or something. Pull it up slowly. So I'm touching still just the part that is going to my skin. So my glove is still sterile. So I'll leave it at this level. Then I'll put this sterile to sterile. So I'm doing it slowly so I don't tear it. Then now I'll use my sterile gloves and I can fix this like this. So my glove is good. So I'll pick this inside and I'll trash it. So I'll go ahead and set up my sterile field, my sterile supply. So to make it easy, Alrighty, so I'll use now this brush, and I'll brush my inner cannula. I'll wash it off, take out all the secretions from here, take out all the secretions, dip this in my normal saline. Then I'll trash the brush, trash it. Then I'll follow the same curvature that came out and I'll put it back inside. Then I will lock it in. Then to continue, I would use my Q-tips, dip it in my normal saline. I'll clean around the stoma site outwardly, trash it, dip, clean outwardly from the stoma site. While cleaning, I'm doing my assessment, trash it. Then I will use this, dry this, trash it, dry the flange, trash it. So now to move on, I'll place back my tracheostomy dressing. So I've put back my dressing in there. So now I'll change the ties, the trach ties. So I'll go ahead, I'll hold my trach down, untie this part of it, still holding my trach down. Then I'll put in the ropes now. So if I was doing this with somebody, with a nurse, with another nurse, they will hold down the trach while I put the rope. So holding my trach down. So I'll tie this. Tie the knot right here. So after tying the knot, I'll put a small gauze underneath here, just to prevent friction and to maintain skin integrity. And then if I have a tape, I'll tape on here. I'll tape on the knot. So after doing this, I'll clear my workspace. Put this in the trash. Return the bed to its original position or to the lowest position. Return my patient's head to the position where it was. Then I'll connect my patient back on his oxygen supply that he was on. Then I'll go ahead, bring the call light closer to him in case he needs anything for him to call. Take out my gloves, trash them, perform hand hygiene. Then thank you so much, Mr. John. Have a beautiful day. Alrighty, thank you.